So next we will have a statement or presentation by Nicolin Tamsma from European Commission on title EU Action on Mental Health. She's a social scientist and health promotion specialist and previously have been working for the National Institute for Public Health and the Environment in the Netherlands, and has also been president of a EuroHealthNet from 2014-2018, and currently she's a policy officer at the European Commission's Director General for Health and Food Safety. And I think we have a connection, we have a picture and also a video connection and presentations already here. So please, Nicolin, you have the floor.
Thank you very much, Ms. Koivisto. Can you all hear me?
Yes.
Super, thanks very much. Good afternoon, I think it's now in Helsinki. It's a real honor for me to represent the European Commission and where I work at the Unit for Health Promotion, Disease Prevention and Financial Instruments. I understand that you will be shown my PowerPoint presentation. Yes, there it is. That's great. Thanks a lot. I'm really delighted to be able to join you today. Sorry, I can't be in Helsinki. So I'm in Luxembourg, where our Directorate for Public Health is based. And I would really like to congratulate you with this very, very interesting event. And thank you very much for the invitation to speak. Can I have the next slide, please? So in my presentation today, and I will really try to make up a little bit of time where I can, I hope to give you some insight in the ongoing work that we support at EU level to advance mental health, and also share some information on past actions and possible future ones. Now, our actions are based on what we know about mental health, about the state of mental health. So I will kick off by looking at that challenge very quickly. And the main part of my presentation will address the two core aspects of the Commission's work. That is our support to EU countries and our work to help tackle the mental health impact of the pandemic. Can I have the next slide, please? Now, mental health problems already posed a major challenge before the pandemic struck. And I have listened to all these data being already mentioned earlier today and probably also yesterday. So I don't want to go into a lot of detail, but our 2018 report on the state of health included a dedicated chapter on mental health, and that has been extremely helpful in getting a broader understanding. It also made a really strong case for promoting mental health, preventing mental illness, and improving access to treatment. The data presented were rather sobering, informing that the mental health problems affected about 84 million people. That we are spending a lot of money on the consequences of mental ill health. This figure is cited still all over, and I think this is why it's so important to do this kind of economic assessment as well. Spending 600 billion, which is more than 4% of what we collectively earn. And again, it's important to keep in mind that only a third of that is actually direct spending on healthcare. The majority of the money represent indirect costs to labour market loss. And we also spend a lot on social security programs. Can I have the next slide, please? So before I turn to the current efforts in mental health, I would like to point out that what we are doing now is really based on what we have learned and achieved over the past 15 years, whereby each new step is really built on the outcomes of the previous ones. And of course, I cannot refer to this without paying tribute to the essential role that Finland actually played by putting mental health center stage in its health priorities during their presidency, their EU presidency in 1999. So since our European health leadership acknowledged then that there's no health without mental health, we have seen the adoption of a green paper on improving the mental health of the population. This was in 2005, and that was followed by a number of important initiatives such as the European Pact of Mental Health and Wellbeing in 2008, and the EU-funded Joint Action on Mental Health and Wellbeing that ran between 2013 and 16. The European Framework for Action on Mental Health and Wellbeing was the key output of that joint action, and it focused on mental health in all policies, on mental health in workplaces and schools, on the fight against depression and suicide, on e-mental health, and on community-based care. To implement that framework, then we set up an EU compass for mental health, which collected policies and practices dedicated to the main areas of the framework. And when this work ended in 2018, the good practices that it harvested were integrated in what was then a new best practice portal from DG Santé that we have set up. Now, I'm really aware that some of the people that in the audience today played a major role in several of these pieces of work. So I would like to thank them very much for their efforts. They are still the fundament of what we're doing. Can I have the next slide? So where does this lead us today? Now, it may be helpful to remind you that the Commission has very, very limited competencies in public health and actually no competencies in health systems and financing. So the Commission's main role in public health, also as regards mental health, focuses on supporting Member States' policy priorities, especially through the implementation of best practices. Now, the steering group on health promotion, disease prevention and management of non-communicable diseases, and apologies for the long name, is our main entry point to take advice from health ministries on their priorities. So that steering group already late 2018 prioritized mental health as an area for best practice implementation. So what we then did is we selected, I think, about 11 best practices, all taken from that portal, therefore all informed by previous work that I just sketched out. So we showcased them to member states, health ministries, and they ranked them then according to the relevance to their national priorities. And then once we knew which ones they really felt were the most important, we included 2 calls to support the implementation of their top 3 practices. Those 3 practices focus on the prevention of depression, on mental health system reform, and on suicide prevention. Can I have the next slide, please? Thank you. So the implementation of this work is supported through an EU contribution into a total of 7 million. And it's funded through the previous health program. So we now have EU for Health, but this is this is the last year that we ran the 3rd health program. So this means that a project to implement the I Fight Depression intervention in 8 different countries started in April this year. A new joint action, the Implemental Joint Action, started in October. And that will implement a multi-level suicide program as developed in Austrian, and a mental health reform to strengthen client-centered community-based services. And as you will see from my slide, there are 3 Nordic countries involved in the work on suicide prevention that is going to be channeled through the Joint Action Implemental. So I'm really pleased to be able to inform you about that. And I'm sure several of you are very aware of this. So to summarize, this new work on best practice implementation responds to health ministry's priorities. It's not linked to the pandemic as such, but of course we do anticipate that it will strengthen our overall response to mental health problems. Can I have the next slide, please? So this brings me then to the COVID-19 pandemic. And that, of course, has had a major negative impact on mental well-being. And your conference has addressed this throughout, I think. So it really exacerbated the challenges that we were already faced, and I described earlier. Now, the graph that you see on the right is taken from last year's State of the Health in the EU report that we published in October. This already informed that over spring and summer that year, the pandemic and subsequent economic crisis led to a growing burden of mental ill health, with emerging evidence of higher stress, anxiety, and depression rates, and already pointed out that young people and people in lower income groups were at higher risk. Now, there have been many reports on the pandemic's mental health impact since, but this is not the place to summarize them, I think. But if we can go to the next slide, I would like to share a visual from last year's World Happiness Report, as I think this really captures rather well what a complex task we are facing and when we aspire to deal with it. And that illustrates how one pandemic wave and the measures to contain it can lead to 4 different types of impact over time, immediate ones and longer term ones. Given that we are now experiencing a 4th or in some countries even 5th wave, I also hope that this graphic gives you a flavor of the kaleidoscope of challenges that are facing us. And given also that we have still so much to be learned, especially about the longer term mental health consequences. I know that the technical advisory group that WHO is actually still active for WHO on the mental health impact of the pandemic also uses this graph in their report. Can I have the next slide, please? So what has the Commission done to address the mental health impact of the pandemic until now? Within a few months of the start of the pandemic, we created a virtual network on our health policy platform. Now, that platform is an interactive tool to boost discussions about public health concerns, to share knowledge, and the entire platform has more than 10,000 registered members. It's really a stakeholder platform, a dialogue platform, and there is about 80 separate network communities on that platform. So in May 2020, we set up a dedicated network space for stakeholders in the health and social sector, so they could share experience and good practice on mental health issues related to the pandemic. This network now has more than 90 participants from over 50 organizations, and it's coordinated by Mental Health Europe. So this was our first step. Can I have the next slide, please? One important step, and maybe I should not forget that in October, after this 2020, we actually ran a first webinar to share the first learnings from that platform and the health policy platform group. But in May, and thank you to Lydia for mentioning this, our Commission hosted a major conference to address the whole issue from different angles. And this conference, actually, there was a really fantastic input, also contribution from WHO Europe side and the technical advisory group. So that's hopefully also an illustration that we work really well together. The conference attracted a really wide audience. I think there was about 2,000 people that connected to us on the day. It was structured around 5 key themes. We wanted to understand the pandemic, or at least share what we knew at the time. We were looking at the impact on the daily lives of people, of different groups, including young people, older people, people with pre-existing health conditions. We looked at the impact on those who provide professional and informal care. We looked at the necessary response from health systems, including services for people with pre-existing mental health problems. And then we closed with a policy panel to discuss action options. But maybe most importantly, we put people's experiences in the center of the conference. So there were many testimonials shared from people, and also the conference showcased promising practices to provide inspiration about what can be done. There's on the bottom of my slide, there's a link where you can find videos of all the sessions in case you want to have a look at them, but also some outcomes, including a booklet of these practices that we showcased. Can I have the next slide, please? Yeah, so as a next step, we choose the theme of mental health and the COVID pandemic as one of the topics for this year's EU Health Award. Every year, the Commission gives an award to outstanding initiatives. And this year, we seek to recognize community-based initiatives that have alleviated the mental health impact of COVID-19. This is really to recognize work by local authorities, NGOs, or other non-for-profit organizations. And you can still submit applications. It closes at the end of this month. Can I have the next slide, please? We've also recently launched a new call for projects to implement promising approaches to tackle the mental health impact of the pandemic. This is supported through our first annual work program of EU for Health. And there will be €750,000 available to support the rollout of 2 or 1, but maximum 2, promising practices. This work is really meant to strengthen community-based knowledge sharing and awareness and capacity building, especially at local level. So there's still plenty of time to apply for this. The deadline is 25 January next year. We're also exploring options to support further work. For instance, to support the mental health of those that are particularly affected by the pandemic, such as young people or vulnerable communities. But our proposals for the upcoming EU for Health work program is still very much under discussion, so it's really not possible for me to say more about it. Just to rest assured that we hope to be able to add more initiatives to the overview that I just provided you with. So can I have the next slide, which is also my last one? Because I'd like to close by sharing a quote from our commissioner. She's a psychologist herself and very committed to the mental health of our citizens. Mental health matters, and we do stand side by side with EU countries, healthcare professionals, and of course all those affected to address what is one of today's most pressing challenges. That's a better mental health and well-being for all our citizens. Thank you very much.